Hi, so it's been a while since I've done a medication update. For those of you who are new here, I have cerebral palsy, inattentive ADHD, generalized anxiety disorder, and major depressive disorder. And I don't know if I'm missing any other diagnosis, but I think that's it. And in my channel, you'll find that I have reviewed tons of different medications that I've tried for these conditions: antidepressants, stimulants, non-stimulants, etc. And I wanted to do a medication update today and talk about a pattern that I've noticed when taking SNRIs, serotonin neuroreuptake inhibitors. That might be wrong, I'm not sure. But I know there are two classes of antidepressants. So you have SSRIs, so those would be like the Trintellix, which I've taken, the Zoloft, and you have SNRIs, which I've taken a couple of, and just to name a few, qelbree, stratterra, and more recently, the one that I'm taking right now actually is Effexor, the generic version of Effexor, which is, I forgot the name of it, venlafaxine? Yeah, so that's the one I'm taking now. And I was initially on a 75 milligrams of Effexor, or venlafaxine, and when I started taking it, I was feeling nauseous and drowsy. But my provider said 75 milligrams wasn't even really a therapeutic dose. So recently, this past week, he increased it to 150 milligrams, and boy, was that an adjustment. I was sleeping throughout the day. I felt drowsy, depressed, extremely nauseous. I basically felt sick all day. Like I could throw up any minute. I didn't actually throw up, but I felt like I came really close to throwing up. And it did not make me feel good. I was just not in a good place. And I took it for like 3 or 4 days, and I had to stop because like my parents and everyone was like, I don't think that medication is helping you. And I feel like there might be an adjustment period for these SNRIs, at least in the way that they affect me, right? Maybe I gotta wait it out 2 or 3 weeks and wait for the side effects to subside, or maybe they won't subside. Maybe they're just not good for me. But the thing is that I can't afford to feel that way for 3 weeks and then wait the side effects out because I have a son to take care of. I'm completing graduate school. I have to complete projects and homework. I'm going to be going back to work in a little over a week, and I just don't have the luxury of having that downtime where I could just be like, yeah, I'm just going to feel like crap for the next 3 weeks, and then after that, I'll probably start feeling better. The last time I tried to do that was about 2 years ago when I first started graduate school. And I remember my provider, a different provider, had switched one of my medications. And I was having a really rough time transitioning, and I wanted to wait it out. And what ended up happening is I failed one of my finals because I just didn't have the energy really to study or put in my best effort because I was feeling like crap. And so I failed my graduate class, and my university made me take a leave of absence for a year before I could continue my classes. So that put me behind a whole year. And so I've decided that I just don't have the time um, to go through that process again. And so I've stopped taking the 150 milligrams of the Effexor. And I'm going to reach out to my provider and kind of let them know that I've noticed this pattern with the SNRIs, that they make me feel like crap, right? I feel like a zombie. I'm drowsy, exhausted. I could sleep throughout the day. But I haven't noticed the same pattern with the SSRIs, which are maybe a little bit of nausea in the beginning, but nothing really compared to how I feel with these other types of medication. And it's been a pattern, like I've said, with the qelbree and the Effexor and the stratterra. And I think that's one of the benefits of having tried all of these different medications is that you kind of start noticing, okay, these don't work so well for me, and these probably work better. I'm not even going to pretend that I know the difference between the SNRIs or the SSRIs and how they work. I probably should do some research on that, but yeah, I just kind of wanted to bring that up. So as of right now, I am on the 150 milligrams of Effexor, which I stopped taking like 2 days ago because it was making me feel terrible. The 26.1 milligrams of the Asteris, which is a stimulant medication for ADHD, and I think that one is working pretty well so far. No side effects as of yet. And I'm also taking the clonazepam, the 0.25. They actually, I think the lowest dose of the clonazepam comes in 0.5 milligrams, but that one was making me really sleepy and sedating me a little bit too much. So my provider told me to just cut the pill in half and take the 0.25. And that one is for the anxiety, and more than anything for the startle reflex, which I've talked about, is the side effects of my cerebral palsy, that I tend to jump and get really startled super easily, and it's really annoying and nerve-wracking. And I think that I have found the one thing that kind of helps with that. I still startle, but not nearly as much as I did before I started on the clonazepam. But yeah, so as of right now, I don't think I've found anything that works super well for me as far as the depression. The SSRIs do have other side effects, like Zoloft made me gain a bunch of weight. But that's part of the reason why I'm excited to start on my TMS journey. So if you haven't watched my previous video, I will be starting on transcranial magnetic stimulation therapy. I've filled out like all the paperwork, and I have an intake appointment in like 5 days on the 19th with the provider who's going to be administering the TMS treatment. And that's going to be a virtual 1 hour appointment. And then on the 23rd of this month, so July, is when he's going to start the mapping process and administer the first treatment of TMS. So I'm excited for that because I feel like I've tried all these medications and none of them have been particularly helpful when it comes to the anxiety and the depression. But I will do my best to keep you guys updated on that and on how that's going. And yeah, I will be back.